So here I have Belly Button, come here. This is my dog, the world's bestest puppy in the whole wide world, and she's 13. So one thing that we have actually in my house and in the clinic for geriatrics is the yoga mat down, which she is doing downward dog quite gracefully for. So in the exam room, we would have this on the floor. We'd also have it covering the surface of the scale. Lower platform scales are most comfortable for dogs because they're not raising up. Some dogs that have an aversion to a scale, if you don't have a yoga mat, you can just put either a bath mat on it or at least a towel to cover it. Shiny surfaces are really, really scary if you're a pet, and we want to make sure that we get an accurate weight. That's part of their exam. So with Belly, she's obviously not afraid to go on a surface, but this really helps provide traction. When you're doing an orthopedic exam, especially, and you're on those hard laminate surfaces, it's really easy for your assistant or your technician to stabilize a patient. You can do really good range of motion techniques when you have a traction mat in place. And it also helps for those fuzzy feety dog. If you have your Shelties, your Border Collies, it makes it a lot easier. So some props that we keep in clinic, starting up in terms of fear-free using a treat ladder. That's the starter treats to the really, really good stuff. I call it puppy crack. So this is my secret weapon, Easy Cheese. It's really, really fragrant. It's really, really palatable. It doesn't have to be refrigerated, and dogs go crazy for it. So your most easy to work with patient is one that is food motivated. So Bella's a really, really good example. She likes to do things as long as there is food involved. So we will just use her as an example to see what you can do in clinic. Belly Button. What's this? Oh, now we got your attention. Can you sit? All right, so at this point, we could have a doctor evaluating the skin. We could have them checking for any lumps and bumps. We've even been able to get fine needle aspirates just from doing this. So one thing about fear-free, right now you could do anything that you wanted to her. She's focusing on me. You can even do an optho exam. You can do a Schirmer-Tear test. You can do so many things. Right now, if you wanted to, I can stick my finger in her ear, not really caring. She's looking around, but she's really focused on having cheese in her face. The only thing that's harder with cheese is doing an oral exam, but it can be done. So one of the benefits with fear-free is just making sure that you have that extra person. If you don't have a technician in the room, what you can do is incorporate the client. They really, really like seeing their dog happy. So if they're able to combine a good experience in terms of a good comprehensive wellness exam and their pet happy, that's going to give you a good return on your investment. So using a lot of treats, you can use a tongue depressor, you can use frozen peanut butter, you can use a lot of squeezed cheese, whatever it takes to get the pet in a focused area. So another really good thing, just for distraction technique, is using the Zoom grooms. I believe they're made by Kong, but Bella's a pretty itchy dog. White pit bulls tend to have a lot of itch. So she will stay as still as possible as long as you're giving her a brush. So just as a considerate approach, you want to make sure that you have your hand on your patient at all times. You're just going to want to make some gentle movements, especially with older dogs. They might have some spinal sensitivity, but you can just go, dogs with long hair like to be brushed a lot. Bella will do anything for a little tushy scratch. So this is something that's $10. It's easy to incorporate. You can easily clean and disinfect it later. So it costs nothing to do that experience. Plus it gives the clients a feel like you're just natural with their dog. You're doing what they do. The important thing during fear-free is still for the clinician to talk about what they're doing. So a lot of times I'll work with my doctor and they'll say, oh, Laura's just going to tickle her butt so I can, feel that mass on her right front shoulder. Or Laura's going to give her some peanut butter so I can get that ear cell cytology and get that started in the lab for you. So even though it just looks like I'm petting my dog, we're able to really do what we need to do to complete our exam. And that's the most important part. Dogs that are a little bit more rambunctious, they can have, what's this? They can have a basket muzzle, and they can still play with toys. So if they're not food motivated, that's the easiest way to work around it. But if they're not food motivated, what you can do, oh, you can get attention that way. What's this? So now you have a distracted dog. If it was a dog that really, really liked to play with treats, you can see how their gait is. You can also have owners distract with toys and treats if you're doing a blood draw. A lot of times we use back legs because it's a little bit less out of their vision, and we can have owners distract with food. Another really, really good technique is actually just using towels and comforters. Clients drop them off at all times. They cost nothing as long as they're clean. And a visual barrier is the easiest way to make sure that a pet is not seeing what's scary. So one of the scarier things for Bella is nail trimmers. even though she looks like she likes them now, she really doesn't. So what I would do for her, if she was a fearful patient in the clinic, is I would start out with priming her with treats, making it a positive experience. Then I'd have an assistant come in, we'd cover her head, we'd tell her that she's a good girl, she can hear her owner's voice. We can do this all with the transparency of having the client involved, so we're not taking her into the back. It's not this scary unknown, and that's what people really want to be a part of. So we do all that in front of the client. They're not expressing their anal glands. They're not having bowel movements or urinating. It's in a very, very easy to understand. And as long as you explain what you're doing, you're putting that visual barrier so they don't see a scary lady coming with nail trimmers because they've had bad experience with it. It's easy. It's simple. It's not rocket science. It's just decreasing fear in your pets and your patients just for a better client experience and also to get them the care that they need.